Hi, so my name's Lisa. I'm really excited to be chairing this panel today. I would really like it if we could start with some introductions. Maybe if I could ask Imogen first, what what your role is, why you're here today, and why it's important to you to be here.
I will certainly kick off. My name's Imogen, as you said. I work for the charity Joe Cervical Cancer Trust, developing their health information. So essentially, I work with the public and with experts to try and create something that makes sense to people and is helpful to people. We're a national charity, so we support everyone who's affected by cervical cancer, and we also raise awareness of prevention, which is why we're here today to talk about cervical screening from my perspective specifically. And it's so important because, I mean, again, from a cervical screening perspective, we want everyone who's eligible for the test to feel comfortable accessing it if they choose to. But there are a lot of barriers in the way. So discussing that, getting it out in the open and kind of starting that conversation is really important to breaking those down.
Brilliant, brilliant. Stuart, can I come to you?
Hi, so my name is Stuart, I use they, them, and I am the founder and executive director of Live Through This, which is the UK's only LGBT cancer charity. We like to try and work in 3 different ways. So we like to work with patients with peer support, then we like to work with healthcare providers by sort of bringing them up to scratch on how best to support us while we're in the system. And then also we like to produce our own resources when we get a chance. So see the gaps out there and like the chest checking resource we made with Copperfield, give something new to the community that didn't exist before.
Brilliant, brilliant, thank you. So could I start with asking, we've got some excellent questions from members of the public, but I wonder if I could just kick things off a little bit by asking what the current issues are. You see, what makes it different for LGBTQ plus people in relation to cancer in particular?
It feels like one of those questions where you want to say, how long have we got here
I know. Yeah, sorry.
I mean, I'll throw one out there, a big one, and I'd be interested to hear your perspective because you've got more of an overview, Stuart, than I have, probably coming from a cervical perspective, is of kind of knowledge and awareness of professionals to anything LGBTQ in a way. So there seems to be what we hear is almost a I don't know what to do with this if someone kind of comes out to a professional in a healthcare setting, and a bit of hesitancy around how to respond to it. So that can be a good thing. It can mean the professionals kind of taking time to acknowledge maybe gaps in their own understanding and to give that person the individualized care that they need. But sometimes it's just that they lack that training or that knowledge to give someone the right support. And that in itself, just straight off the bat, is a huge barrier if the person who's meant to be a professional in this situation can't respond to that part of who you are.
Yeah, I definitely agree with all of that. And I think you're right in the sense that sometimes people providing the care or doing the test, they haven't had enough training. And this also goes down even just to their core medical education. You know, right from the beginning, they're taught that LGBT stuff is an elective. They can opt into it if they've got the credits. So what that kind of does is when they go forward into practice is it still stays almost, you kind of get this implicit bias that LGBT considerations are elective. Whereas really, especially with NHS goals of personalised care, what's more personalized than your identity? You know, it's who you are. So it's really important that people are able to support us, and then especially thinking about when we actually access the system. So there's things around, you know, misunderstandings that sometimes persist. So around who needs the screening and who doesn't. You know, some lesbian and bisexual women think they don't need the screening when they do. And sometimes this is perpetuated by doctors who've heard it and haven't been corrected. And unfortunately, I sometimes kind of talk about it almost like a ripple effect. People can come away from their care experiences, and this is what we take back to our community. And we don't have enough LGBT-specific health messaging to combat that. So this is where our charities and like Joe's Trust do the work we do to try and get the right messages out there. And also another thing Imogen touched on there, which was so important, was the interaction that you have with the healthcare professional when they show some hesitancy. this can sometimes, from our perspective, feel a little bit like microaggressions, in the sense that, okay, this person feels like they don't understand me, or they're feeling awkward in interacting with me. And it's something that I always try and push when I'm educating doctors, in just having this fluency, having fluency with the language we're using, having fluency with our community, and also an idea of cultural humility. We're not expecting you to understand everything about our culture, because we do have one, and we do have ways that we like to talk and sort of support each other. But just understanding that you can work with us towards that goal, rather than pulling back because you're not sure that you're doing it right.
That's really interesting. And I wonder if I could just pick up on something you said there, because you said that, and I've come across this as well, where the information isn't available, or people or healthcare professionals maybe feel a bit awkward. But you said that actually they sometimes give the wrong information because they've heard the wrong things as well. Have you got any examples of that, or anything you can share?
For me, it's something that tends to come up is HPV transmission risk. So as we know, HPV is something that a lot of people have, and there's a high risk HPV that can sometimes lead to cervical cancer. But there is this misunderstanding that if you don't have sex with men, then you're fine. You don't need to worry about it, which is just not true. You know, HPV can be transmitted in multiple different ways, including fingers, toys, anything. So really, we recommend that if you have had anything in the vagina, then you should go and get screened. So it's these kind of things. And unfortunately, these ideas, they perpetuate through health. And it's these, I tend to feel people are more often sharing bad experiences than good experiences. That's just human nature, right? So it's also making sure that when someone has this bad experience, and we've seen it published in literature, where people will then come away, and because they've been told this, and because it's been almost a traumatic experience of getting told this, because they give themselves to go get a test and then they didn't have to go through with it, there's almost this relief they take back to the community of, oh, I'm so glad I don't need a test. And that's really what we're trying to combat, to be like, okay, it's not the most wonderful procedure in the world, obviously, but it is needed. And there are ways to make it more tolerable. There definitely are.
Yeah, I mean, on that point, yeah, LGBT Foundation, I think it was, found that 40% of bisexual and lesbian women had been told they didn't need cervical screening directly because of their sexual orientation, which is dangerous more than anything else. We're denying people the chance to access this test, which is so important. And it also comes back to something that I think Stuart touched on around heterosexuality and being cis as the default. That's kind of what we always go back to, and that's how we respond to people. So you're putting patients in a position of having to continuously come out and face the emotional burden of that, of trying to weigh up, well, what does this mean to me? Am I going to put myself at risk by disclosing this about me? So there's so many things that could be dangerous for that person in that situation, from the incorrect information to kind of showing that part of themselves to a professional.
Absolutely. Can I just I can agree with that. Cis heteronormative sort of, I've had myself when I'm a nurse, but when I've accessed healthcare, sometimes I've had that, you know, asking about my husband and stuff. But anyway, that's a whole other story. So I'd like to move on to some of the questions from the public now, and it ties in quite nicely with some of that. The very first question is, have you got any tips for dealing with medical staff and around things like booking appointments and even accessing that help?
Yeah, I'd like to share a story from one of our volunteers, actually, if that's all right.
Please.
He found it so helpful to have a person that he trusted be able to almost test the waters for him before a cervical screening. So his partner was a cis woman. She happened to have her screening a couple of weeks before he was going to go, and so she was able to kind of go have a conversation with the same nurse who was going to be doing his screening, kind of explain the support that he needed, all with his permission. And just having that kind of groundwork laid made him feel so much more comfortable going into that situation, and also made it a really positive experience. It sounds like for both him and the healthcare professional, where the nurse was able to kind of learn and address gaps in her own knowledge about that. Obviously, not everyone is going to have the luxury necessarily of having that kind of pillar of support there, But if there is a trusted person who can be there with you, be there when you're kind of on the phone booking an appointment, or even just advocate for you, that's always something that we say, if that would work for you, it's worth kind of having that conversation.
Definitely. Well, I think conversations are so key. And I think sometimes when you're a patient in the system, you can feel like asking for one, it feels like you're taking up too much time. You know, the system's stressed and you feel hard to advocate for yourself in that way. But a really good thing is, if you're not sure, call ahead and just say, okay, so how is this going to work? How's this going to go down? And there are some things you can ask for, you know, especially if you're not used to having anything in the vagina. You can say, you know, have you got smaller speculums? Can you talk me through how that's going to work? Or you can even do things of, say, you know, I'm trans and my name, I don't want the name called out that's on the record. Can you call me by my initial and my surname? Or actually, I feel uncomfortable in the GP waiting room. Can I get the first appointment of the day or the last appointment of the day? There's other things you can do around that. And there's also, you know, the other options where if you feel really uncomfortable with your GP, or your GP doesn't know you're trans, or you've just had a previous bad experience, you don't necessarily have to be trans, have a bad experience in healthcare, but you can go to other places like sexual health centres, you know, and they may be a little bit more understanding about these kind of things because they're less squeamish around sex, to be honest. So there are options out there. And I think the other thing that Imogen touched on as well is the importance of people in your local kind of community having good experiences. And that's what it takes, you know, to be able to connect with other people and just check, hey, did you have a screening? Where did you go? How did it work out for you? So obviously our charities are here to kind of help field questions, give information. But I think there's something really special about when someone you know that you can trust has been somewhere, then you can lean into that and feel like it's going to be a safe place too.
Absolutely. And sorry, Lisa, I was just going to say, I think it's really important to say, particularly for kind of a national charity like ours, where we're trying to support everyone, is we couldn't do kind of the work we do and the support we give and the information we give without connecting with members of the community who have had all kinds of different experiences, but let us kind of understand what they've gone through and build the tips around that. And something else on the tip front is also just to know your own boundaries. So I think you mentioned, Lisa, as well, when you go to an appointment and you get all of these questions thrown at you, you don't have to engage with that. If that is too invasive and you don't want to disclose something, it's your appointment, you are in control. It can feel quite scary when you're kind of up against a healthcare professional who can be a figure of authority to set those boundaries, but it is to think of it that way, that you're in control. It's your test, your appointment, you get to say what goes and what doesn't. That can kind of give you a sense of empowerment around the whole situation.
That's brilliant. And can I just say, as a healthcare professional, is that's what we want. We are there to help people, and that is definitely what we want. You know, people shouldn't look at us like we're the professional, all-knowing person, because often we're not. It's the individual that knows most about themselves, isn't it? The next question on the list is very similar, but it's specifically, have you got any tips for non-binary or trans people in particular when they're accessing services?
Yeah, I think when we think about screening, especially, the trans one is such an important one because a lot of it comes down to how you're registered with your GP. So, you know, if you have a cervix but you're registered as male, you won't be automatically called for your screening. So hopefully your GP will have an internal system that we call safety netting, where they have on file that they know you need screening and they'll actually kind of make the first move and invite you. But if not, you'll need to advocate for yourself and ask for that screening. And I think this is also something that's true for trans people in most of the screening programs, and even things that don't have a screening program like prostate. There's no national screening program for it, but you need to advocate for yourself if you feel like you have concerns. So if you have urinary symptoms or you have discomfort, things like that. And especially for a trans woman to have to then advocate for herself in a scenario, it's really, I think, you know, the medical settings should reach first to make you feel like it's a comfortable space, whether that's posters, whether they've signed up to additional training, whether they've got policies on the wall to make you feel like it's a good space for you. But there are, as a trans person accessing, there are ways you can sort of, as Imogen said, take some control in your situation. So like we touched before on calling ahead. Another thing as well, I really liked what you said about boundaries. And I know a lot of us feel when we go in about inappropriate curiosity. You know, is this really actually relevant to what I'm here for today? And this comes into being trans, but also who you're having sex with, and is this really relevant to my appointment? And if there's anything that ever comes up, just ask. Just that's what the appointment's there for, just to say, especially people asking about gender history, is this relevant to my test? Do I have to discuss this today? Like, can we touch on this some other time? Just so you actually find out you're there, what you're there for. You can get the test you need in a way that you feel comfortable. And that also you check as well, how are you going to get the results? Think past the appointment. Think about, when do I need to come back next? And kind of get yourself into a good system of engaging with it so that you know you can access your screening regularly and with confidence. That's
really good. Thank you. Imogen, have you got anything there?
I think Stuart's covered everything, to be honest. I mean, the trickiest thing about accessing it, again, for me, speaking from a cervical screening perspective, is those systems. They aren't set up to really help a trans and non-binary patient right now. And it does mean a lot of the onus is on that patient to make sure they're kind of remembering appointments, remembering to ask for different names on invites maybe, or like Stuart said, to kind of not tell the receptionist directly what they're there for, and that makes it extremely difficult. But there are things that can help with the test itself. And I think as well, if someone was, for example, on testosterone, you know, with cervical screening, that can mean the speculum part is particularly uncomfortable. So there are things there, conversations with doctors where they can prescribe, if it's acceptable to that person, an estrogen prescription to help with that. Like Stuart said, there are smaller speculums. There are ways to make the test itself better for that person. It's more those structures around it where we kind of need to see more progress to really support the patient.
I wanted to come in quickly there as well, because I think it's a really good point you made about comfort in the procedure, because a lot of this we're talking about as well has a clinical impact. So we're not just thinking patient experience point, which is very important, but also the more uncomfortable you are in the procedure, the less likely the sample is viable, which means you might need a repeat test. So sometimes as well, if you had a pretty bad experience and they asked you to come back in, it might not be because there's something of concern. It might just be that you need another test because the sample didn't go very well, or the lab refused it, because that sometimes happens with the current system. So there are other things like that. The other thing I sort of also wanted to mention, because we touched on non-binary there, is being non-binary myself, the current system is very binary in the medical model, and we're trying our best to put pressure on to change that, I promise. But what that does do is, and we saw this in the GPPS patient survey data that just came out, so non-binary people were having a pretty poor time. And I just want to acknowledge that, you know, when you're a non-binary person and it feels like the system is, are you this or this, and you're somewhere between, and the system doesn't even have a good way to accurately monitor that, it can be pretty tricky. But, you know, stick with it, pick the gender on the record that works for you best, but also talk to your clinician and just say, you know, if I register this way, how does it affect me? You know, like if I register this, am I on these screening programs or not? How does it affect my healthcare? Just so you know, so you're fully in control of your medical record.
Brilliant. So we've talked about cervical screening. We've obviously touched now on prostate screening, which isn't a national screening program, as you say. That's something, again, that somebody's got to look out for symptoms and own it really themselves. What about things like breast screening? Because obviously where there has been top surgery, for example, there is still some breast tissue sometimes. Yep. And also, you know, there's some evidence that trans women will have, with the hormone treatment they have, are at a higher risk of breast cancer, aren't they, than cis men. So what would be your advice there?
So there's a couple of things touched on there, and they're all correct and very important. So one of the things is top surgery. So we'll start with that. So top surgery can often leave behind some tissue that we say is at risk. That doesn't mean, you know, you've got a high risk of getting cancer. It's just it's tissue that needs to be monitored. So typically when you have your top surgery, you're leaving behind tissue to have a masculine looking chest. And that's different to what we call double mastectomy, which is where we take away everything to avoid a cancer risk. So normally what stays is nipple tissue, an area around that, sometimes under the collarbone, sometimes into the armpit. And if you're unsure, you can check with your surgeon and just see, okay, well, how did my surgery go? What have we left? What's gone? So that's one thing. And even when you have had top surgery, your risk does decrease because there's a lot of tissue that's gone, but we still recommend that you keep monitoring yourself. And we've got partnership information with Copperfield for that, and I'll make sure there's a link that people can access for it. Then when we think about trans women, the development of breast tissue can increase your breast cancer risk, and also taking feminizing hormones, but that increased risk is no greater than cisgender women. So it's important to remember that. And also the screening program actually starts quite late. And I think a lot of people don't understand that. So I've met a lot of trans people, especially trans men, who feel like they're being excluded from the breast screening because of the way they're registered. And the reality is yes, there are the same problems around what your gender is on your record in regards to being invited. But the breast screening program starts so much later that actually for people in their 20s and 30s, it's not really a real concern. However, we do recommend that you keep monitoring yourself because it does happen. So again, it's knowing your eligibility. Cancer Research UK has some wonderful guidance on that, specifically for trans people. So there are sort of areas of risk related to transitioning, but ultimately, I think it's also important to remember that transition itself can be life-saving.
Oh yes, absolutely.
So it's always about balancing that. And so I think sometimes we always ask people to advocate for themselves in that capacity, especially if you do unfortunately get cancer. There's nothing wrong in saying to your doctors, hey, this is also part of my health, and this is what keeps me happy. And this is something that I want to protect. Because when we think about things like breast cancers, because they can be hormone driven, sometimes there maybe needs to be conversations around how your hormones may be affecting cancer, pausing them slightly to figure out what's going on. So it's always fine just to explain like, hey, you know, this is what's been going on. This is how long I've been on treatment. Just be as clear as possible. And again, we've got contacts and teams that can help support with that.
Absolutely brilliant. That leads me on to the next question, actually, which is about sort of advice for dealing with. You've talked a little bit about sort of diagnosis and post-diagnosis, advice for dealing with body changes after diagnosis, which obviously is tough. Have you got any sort of advice, or are there support networks for that?
There's one key thing I want to point out that is almost this slightly strange idea, that sometimes the changes can be positive if that's the direction you're going in. So say, for example, if you have a lump in your breast and you actually wanted top surgery, it's worth mentioning that to your surgeons and saying, actually, I was going for a flat chest. Is that okay? You know, just checking. You will still need some monitoring, you still need to make sure everything's fine. But it's important to be clear with people what your body is to you, what your goals are, and how you'll be happy. Because otherwise, you know, sometimes conversations can still be pretty cis heteronormative, and things like breast cancer still talk about reconstruction too often, and it doesn't really follow a patient-led model in that way. But in regards to change to the body, there's actually a wonderful sort of patient clip from someone who was at the Trafodaeth gender clinic, and they had a GI cancer, so sort of a lower stomach cancer, and basically they were talking about how, with their experiences of being trans, they just sort of had to grapple with their body and sort of make peace with it and sort of carve their own happiness, as it were. And then having cancer sort of threw up those same questions, but almost because they had been through it slightly before, in that sort of making peace with your body and setting a path, it had almost given them some strength to go into the system with. And I think this is something we've also seen in the peer support group that we run. So it's currently online and available, and we're going to hopefully go back to in-person meetings soon. But sometimes being queer gives you the skills to come out with cancer and tell people about yourself, a new part of yourself you have to share. But also, I think our community is quite good at a radical love in the way we support each other. And I think that's something that's quite special and that we can definitely help each other with.
Absolutely. Imogen, have you got anything to add there?
Yeah, I mean, cervical cancer is rare, first of all, really important to say that. It's quite an interesting one because we generally have a slightly younger community. And so one thing that comes up a lot is the idea of fertility. And one thing that we know is that trans or non-binary people with a cervix, that may still be something that they want to pursue and that they see in their future. But I mean, we hear from cis women who obviously are devastated by it, have a lot more of a support network around it, a lot more resources to deal with it. for trans and non-binary people who are kind of going through the same thing and struggling with those feelings. There's not a huge amount of support there. Obviously, we would say, please contact us. We are here to support you. But there's not the same numbers. Basically, it's a numbers game of people who can really understand that experience. And so that can be really tough. And the other thing about, I guess, cervical anything, but particularly cervical cancer treatment, is it is so much about your genitals and that part of your body. And so it can cause so much dysphoria for people. It can be really difficult, the treatment that people can have, whether it's a surgery or whether it's something like brachytherapy, so internal radiotherapy, which where rods are kind of inserted through the vagina. It can just be completely grueling and distressing and horrifying, over and above the fact that it's a very intensive cancer treatment in the first place. And again, something that we're just keenly aware of is this being a rare cancer anyway. It's difficult to get support. When you come from a marginalized community and you're going through it, it's even harder. There are wonderful LGBT specific organizations out there, Live Through This being one of them, who are there to support everyone. Again, we're also here to support it, but just to acknowledge that it's so difficult to cope with that kind of thing.
Yeah, and I just want to quickly add in as well, because you mentioned brachytherapy, and I think that's such an important thing. Sometimes people think treatment is, bouts of chemo or a surgery or something, and sometimes there are some ongoing sort of long-standing procedures and some internal radiation that happens, and sometimes there'll be questions about safety with partners and things like that as well. And we see this in regards to prostate and men who sleep with men, or anybody having anal sex with a man for that matter. So it's thinking about partners and sort of questions and risk, and there are answers out there. So Prostate Cancer UK has some good information on this, and it has some good information for trans women as well. But also we've got some extra information and experts on hand. So if ever you kind of are looking around and you see there's not enough information out there because Imogen's got it right, there's just not enough resources, unfortunately. And we're trying our best to sort of catch up. But you're always welcome to contact either of our charities with specific questions you have, and we'll do our best to get the answers to you.
That is amazing. There was one more question that's relevant to that. It's kind of linked in, and you've answered most of it anyway. But there's a question here: as a trans person, am I at higher risk of cancers or illnesses?
I think it's one of those things where there are sort of it's hard because it's a trans person here, right? So we're not sure if they're a trans man or a trans woman.
We don't know. It was questions from the public.
Yeah, so it is one of those things where unfortunately a lot of this research is emerging, and that's because it's not been sort of medically of interest prior, and this kind of goes back to what we were saying about the bias in medical education and stuff. Yeah. So as you kind of rightly pointed out, with breasts, we do know there's some specifics around trans men and trans women, and we do have some stats from that. And I think sometimes a lot of it is, it's a difference between, am I at risk because of the hormones I'm taking or the surgical interventions I'm undergoing as part of my transition? Or am I also at risk because of the patient model at the moment and how I access stuff? And I think there are sort of questions in both, and we touched on breast, but I think also one of the key ones that you can mitigate is that barriers to access of screening, because if you're not going to be automatically called, make the effort to go get your screening. And screening is always optional, but I recommend it, and I think it is one of those things that if there is a barrier that you can sort of overcome to make it less likely that you have a cancer that might be, developing without you knowing because you're not going to screening, it's just worth checking it out. And if you are finding it difficult to understand, well, where can I go? Either look online for the information, again, come to us for support, but also as well, identify if there's any LGBT healthcare providers or LGBT supportive healthcare providers that you can get questions from or you can access, so that the whole procedure feels more affirming and you're more likely to be able to build up a good routine of screening.
Yeah. I mean, I think Stuart's hit the nail on the head there by saying we just don't have enough research for a lot of cancers. We just don't have the numbers. We don't have the data to know for sure. With cervical in mind, obviously, almost all cases linked to HPV. And we know that there are some people who may be at higher risk of high-risk HPV that may develop. So men who have sex with men being one of those groups. And also transgender people are also eligible to get the HPV vaccine for free. So if this is something that you're interested in, speak to your sexual health clinic and see if that option is available to you. But as far as giving people those definitive numbers and those definitive answers, we just need more research, and we need better ways of recording this kind of data so we can provide the right information and support.
Yeah, and I should point out as well, so one of the reasons why we don't have a lot of data, it's not that we're not trying, but because the current NHS system doesn't have a good way to monitor trans people, we're missing out on a lot of data. So we're actually working really hard to change that, and fingers in many pies to get it happening. But that will be sort of hopefully the turning tide to give us a bit of a clearer picture so we can give people more definitive answers. But another thing you can try and do as well is live a healthy lifestyle as much as possible, avoid excessive drinking and smoking. These kind of things can really sort of increase things. And also, if you are HIV positive, making sure you're up to date on your medication, that can really help as well.
Excellent, thank you, brilliant. I guess the final question, well, the last but one question from the public that ties into that is, will being trans affect my treatment options? Which I think you've kind of already answered.
It's a very important distinction, I think, because the option for screening remains. And I think that's it. I think the automated process by which you're invited will change depending on how you're registered with your medical system.
GP, yeah.
But your option to get screened remains. So if you feel you need screening, you can access it. And your doctor will make sure it works. Even if you've had top surgery and you want to get your chest screened because you think there's a lump or there's a point of concern, go to your doctor. They'll find a way to get you there. You may not be having the standard the mammography machine where it presses on the plate, but there are other methods. So don't think, oh, but I've got this bump. Oh, but I don't have, my breast tissue left. I can't get scanned. That's not true. There's scanning and options available out there. So I don't think it sort of removes options per se. It's just sometimes it can be trickier to access.
Any sort of treatment options that might be different or hindered? This is what the question is.
Off the top of my head, I think when it comes to thinking about treatment, there may be additional conversations you might want to have in relation to if you're on a transition pathway or you're taking hormones in relation to your treatment, but nothing should really block you from having treatment. It may just be that you have a deeper conversation about what kind of treatment you want to have or what kind of surgeries you want to have. And there are colleagues that we have that can help navigate these conversations from both the gender position as well as the oncology position. So those kind of two teams can talk to each other a bit better.
Okay, brilliant.
Yeah, from a cervical perspective, it should just be, here are the options for treatment. If you have a cervix, your options are kind of fairly cut and dry. They are there, and you should be having that conversation around them. And it's about patient preference and understanding and weighing up the risks and benefits. No matter how you identify, that should always be there.
Absolutely. The final question is, where can I get support? But I think that I'm wondering if, before we get on to that, if maybe it's worth talking about some of the other not so much screening, but sort of self care and self sort of things like breast testing, testicular testing, that sort of thing. Have you got any sort of advice or any tips for that at all, or any advice you can give to people? I'm not asking you to demonstrate. I'll try and get some links. I'll try and get some links. Yeah. I'll try and get some links to some videos. There's some really good videos, and I'll try and get them attached to this. But yeah, any advice?
So I definitely recommend people check out the chest checking guidance we released. So this is a gender neutral chest checking guidance to help people with any type of chest know how to check themselves and how to advocate for themselves. And we have little mentions of how to navigate dysphoria. So things like that are really, really useful. Other things, like if you have testes, making sure that you are checking them regularly. And with stuff like this, well, if you're not sure how to do it, you can check online, or next time you're at your doctor or sexual health checkup, you can ask there. And you can just say, okay, so, how does this work? I mean, admittedly, I was very bad at it, and I'm in my mid-30s and someone only just showed me how to do it properly. So you're never too late to learn. And then the other thing as well is there are other risk things you can avoid. So it's like using protection during sex. When we think about HPV transmission, barrier methods aren't a perfect sort of barrier to it. There is still some chance of it being transmitted, but just making sure that you are taking as many sort of positive health steps as possible, and you also get used to your body. So you know how your body feels, you know what's normal, you get a regular routine of hopefully monthly, just sort of like feeling yourself over, just checking if there's any kind of new moles or bumps or lumps you're not sort of aware of. Obviously, sometimes these can be hormonally. So if you have a period, sometimes it can be to do with that, especially when we think about breast and if there's any tenderness. But again, we've got more information on that with the Copperfield thing. And we actually have pages of guidance related to changes during transition and how it affects breast health and monitoring. So there are lots of things that can sort of help you make positive steps.
Amazing. Imogen?
Yeah, like Stuart said, knowing your body is so important when we're thinking about things like symptoms awareness, and particularly, you know, when you are on different medications or testosterone, things like that, it can cause changes, but don't be afraid to go and ask about them, get them checked out. Even if you're convinced that they're linked to one thing, it's better just to be safe. I'm going to be slightly naughty and skew the question a bit for cervical, because there's not a huge amount you can do just by yourself to check that out, but we are really hopeful that self-sampling is going to come in fairly soon, fingers crossed, which will make the test so much more accessible for so many people. It will mean people can do it in the privacy of their own home, an HPV test with just a swab, no speculum required, and that we think will open a lot of doors.
Right, can you tell us a little bit more about that? It's literally the swab. Please do.
Yeah, it's kind of a swab. I guess the closest I describe it to is a bit like kind of a cotton bud. It's not a cotton bud, but similar to that. It has a little marker on it. You would insert it into the vagina up to that point. You don't have to hit anything specific. We're just going for the general area. Pop it in a tube, send it off to the lab. And what it's looking for is HPV, which we've spoken about throughout this. Most people will be fine, no HPV there. If you did have HPV, you'd be invited to the doctor just to kind of check everything out a bit more closely, make sure there's no changes happening to the cervix. But it's that, I mean, the fact that you can do it in your own home, you could ask a partner to help if you want to, you could go and do it in the bathroom of a doctor's surgery if that feels better. It just gives people a lot more options, and kind of removing the speculum element for so many people is going to be a big help.
Absolutely. And I guess then if there were HPV cells shown, then they would then go down the sort of traditional smear as they're called, you know.
Exactly.
Well, I also want to mention as well, because we've talked about HPV a lot, and it's an important thing, especially when we think about cervical cancers and especially head and neck and places like that too. But it's also, I just want to point out that there's no stigma associated to having HPV. There's so many different forms of HPV, and a lot of people can have different types of HPV. Sometimes it can cause no real issue. Sometimes you might get different warts, different places, and then they just naturally resolve. So sometimes there can be this misunderstanding that HPV means someone is having too many partners or they've been too reckless, and it's nothing to do with that at all. We just only want people to check so that they know if they just happen to have had it, that they can monitor it in case there's any potential cancer risk.
Absolutely, brilliant. And I'm guessing that while you're here, Stuart, as well, there are other kinds of screening as well, aren't there? So there's the bowel cancer screening that comes in 60, I think is it after 60? Yeah, so there are other screening sort of tests to be aware of that are not gender specific necessarily, but just to as a health promotion thing. It's good to get in there. Is there anything else you think that people need to be aware of if they're having to take a bit of an onus of their own health and things? What else should people be aware of?
Yeah, definitely. So bowel's definitely one of them. Aortic is the other one. So if you are male at birth, making sure that you're up to speed on that. And so if you're a trans woman, making sure you're asking about your aortic screening. Then also another thing as well, just generally if you're trans, making sure that you're getting your blood work checked and everything's healthy. Especially, you know, if you are self-prescribing like some do, trying to make sure your GP is at least slightly aware so they can kind of keep you safe. That's important, because we know the waiting times are obscenely long. Obviously, we kind of touched on prostate, and although it's sex specific, it's important to kind of mention, you know, don't wait for an invite to a prostate screening if you think you have a problem. And sometimes urinary differences can happen as part of transition surgery. But if there's anything that's kind of specifically giving you cause for concern, do ask, do go get checked. I think it's important to remember that a lot of us feel awkward going to the doctor, but they do this stuff all the time. It's literally their job to put fingers in places that you probably don't want them to, and it's entirely normal. So don't ever feel like, you know, you're putting yourself in a position where you're making them feel uncomfortable. And if ever they do have this slight sort of hesitation, like we touched on earlier, it's probably just naivety more than anything. And this is where, again, that sort of cooler head can really help everybody in the room, so that if you are, for example, a trans woman going for your prostate screening because you want to request it, give them a heads up first, so they've got time to sort of make sure they're fully prepared for you. And then you're probably more likely to have a good patient experience. But that's obviously if you feel comfortable sharing that with the admin staff or the front desk. It's always at your own kind of point of comfort. But generally, just as we said before, keep an eye on your body. Don't drink excessively. Don't take drugs excessively. Don't smoke excessively. Try and do everything in moderation, please.
Absolutely. And check, like you say, check. Things like the aortic aneurysm sort of screening. I have to say, I'm a nurse, didn't know about it till I read about it in preparation for this. So I think that's really, really important that trans women are aware of that they are still at that increased risk.
Yeah, and I should also point out that, just for clarity, that's not a cancer. That's just something that anybody signed male at birth needs to have, because we've got this valve in here that needs to be checked.
Absolutely, brilliant. So I am going to lead on to the final question now, which is the big one, and hopefully we can link it to some sort of websites and things and videos as well when this goes out. But okay, so you've mentioned a few places already, but just for clarity, where can people go for support?
So many places. I'm going to be really cheeky and plug Cervical Cancer Trust first.
Please do, please do.
As I said, we're here to support anyone LGBT. We have specific information on cervical screening for trans and non-binary people with a cervix, and also for professionals who are supporting them, because that's such an important element. We work with LGBT Foundation, Gender Identity Clinic, Clinic U, and some trans-specific clinics as well, who would just do such wonderful work, not only with screening, but kind of sexual health generally, and other specific health issues. So Clinic U, there's Clinic T in Brighton, My Body Back will also support trans people. Stuart, you probably know more specific clinics than I do, but there's just so many out there, and I didn't know about them until I started looking into it. Sometimes we've got to dig quite deep to find them, but they're out there, they're trans-led, they completely get everything that's going on and know how to provide the right support. And then there's obviously organisations like Live Through This, who provide wonderful care. But what's really heartening to me as well is kind of national charities. So Stuart, you mentioned Cancer Research UK, obviously Prostate Cancer UK, we've talked about Copperfield, who kind of cater for everyone, but are really making a very explicit effort to be inclusive and talk and support specifically LGBT people. So, I mean, seeing these partnerships is just so wonderful, I think, and hopefully we'll give everyone a little bit of hope that we're moving in the right direction.
Well, there is also, I will just jump in quickly to say, there is a Public Health Wales, quite a good Public Health Wales cervical screening leaflet that's available. It's really easy to find. It's really, I know we can put some links on as well to that. But as you say, services are hopefully becoming a little bit more inclusive. Apologies, Stuart, go ahead.
No, it's fine. I think that's important. And it's also good to know what's in your local community, right? Because obviously, so I'm in London and we're quite spoiled because we have 56T and we also have Clinic U and we have all these other things. And also, you know, in the north of England, there's some like Butterfly Clinic. And so it is good to check if there's any kind of trans-led services around you, because they can really be a world of difference. And then as for information support, Imogen hit all the big ones, which is fantastic. There's also some work we're doing currently with Macmillan to help just give them some sort of landing pages so they could be more inclusive. And Macmillan also came under fire recently by being more inclusive, because we know there's certain people out there that don't like that. So they are moving towards making their pages as inclusive and sort of gender neutral as possible, not to erase anybody, but just to make sure that anybody with a cervix accessing that information understands it's for them, and etc. And then also when I think about direct support, so we touched on prostate a bit today, and there is some support there. So there is a group called Walnut in London that's doing online sessions because of the pandemic, and hopefully they might maintain some of that. And there's also another one up in the north of England called Out With Prostate Cancer. And again, they've been doing online sessions, and it's a very wonderful group run by a colleague of mine. And then we have our groups that we do in partnership in person with Maggie's when we're able to, with the pandemic in mind. And then we also have an online version. So we do that monthly. And it's a space for anybody LGBT who's affected by cancer to come. And I designed it that way because I have cancer. So I have blood cancer. It's chronic. I live with it. And what I found was being a non-binary person with a chronic cancer, quite young, I'm holding on to that label as much as possible. I didn't fit into any kind of support structures that were out there. And anytime I wanted to go to a support structure, doors closed to me, and I'd be trying pushed into the ones that they thought was appropriate. So what I did was I created one that was open to anybody, irrespective of tumor. It can even be your partner, and you just need to come and talk about it. And then what happens is then we get a wonderful mix of ages, genders, backgrounds, and everybody just gets to come and talk about the experience of dealing with it rather than thinking too much about treatment plans, etc. So we do that monthly. You can find the information online. You can sign up via our website, which is livethroughthis.co.uk. There's a little banner on top. And then you can also follow us on socials. So LTT Cancer is where you can find us on Instagram and Twitter. Twitter is a bit more sort of the sciencey kind of research stuff we do, and then the Instagram's more of the fun stuff.
Cool, brilliant. Thank you so much. Well, I think we've covered a lot. Hopefully there'll be discussions, and hopefully when there's discussions attached to this, we can think of more answers to more questions as well in the future. But thank you so much for giving up your time and for coming to join us. I've learned loads, and can I just say, just finish off, I totally echo what everyone says. As a health professional, we do not care. We do not care about anything. We are unshockable when it comes to things. You might be embarrassed, we're not. We've seen it all before. Okay, thank you guys.
Thank you so much for having us.
Thank you.